What does PrEP look like for a C-section under planned general anesthesia? If you know that you will need or want general anesthesia for a C-section, this is definitely something that's important to understand, because when someone is going to sleep for a C-section, we try to limit the induction to delivery interval, which is the length of time that mom is asleep prior to baby being delivered. And the best way to do that is to have all of the surgical prep done prior to induction. So as soon as the patient is put to sleep, the surgery can start immediately. Let's walk through some of that. Before going to the OR, it's the usual stuff: consent, IV placement, IV fluids. Some medications are given, which might include Tylenol, an antacid, antibiotics. In the OR, instead of walking in and getting a spinal as the first step, instead the patient just lays down on the OR table, pillows behind the head. A Foley catheter will need to be placed. That keeps the bladder from becoming over-distended during surgery and also allows us to monitor urine output. Anesthesia monitors need to be placed, blood pressure cuff, pulse ox, EKG leads. Fetal heart rate's checked. SCDs are placed on the legs, which squeeze intermittently throughout the surgery. The belly needs to be prepped, and that prep takes 3 minutes to dry, after which the drapes can be placed over the patient. Same setup as with a spinal. The patient needs to breathe oxygen through a mask, ideally for at least 3 minutes before going to sleep. And there needs to be a timeout where everyone says their name, what they're there for, and does a safety check. When it's time to go to sleep, the arms are out to the side on the arm boards, and the arms do need to be strapped. I rant about arm straps, which are not appropriate for awake patients, but are for patients who are going to be going off to sleep. And then a couple more deep breaths of that oxygen, induction medication is given, and patient is off to sleep. Regarding medication for anxiety, no part of this setup, including the placement of the Foley catheter, is an indication in and of itself for IV medications. However, if this whole process causes anxiety, if severe anxiety is the reason the patient is requesting general anesthesia, well, severe anxiety is an indication for anxiety medication.